Hello, you're listening to The Wire's daily update on the coronavirus pandemic. Today is the 2nd of June. Nearly 2 lakh people have been affected by COVID-19 in India. Over 5,000 people have died and over 95,000 have been cured or discharged. Bollywood music composer Sajid and Wajid Khan's mother, Razina Khan, has tested positive for coronavirus. She is admitted to Surana Hospital and Research Center in Chembur. This is the same hospital where Wajid passed away yesterday because of complications involving a renal ailment and COVID-19. A BJP MLA is among the 417 people who tested positive in Gujarat yesterday. Naroda's BJP MLA Balram Thawani tested positive for coronavirus on Monday. He is the third MLA after Jamalpur Khadia Congress MLA Imran Khedewala and Nicole BJP MLA Jagdish Panchal to have tested positive. Mizoram was declared a green zone on the 9th of May, but as movement restrictions eased and people migrated back to the state, 12 people have tested positive for the infection. Even as Unlock 1.0 has commenced in the country, the Mizoram government issued a fresh set of guidelines, laying stress on social distancing and vigilance along the state borders. Tripura and Arunachal Pradesh have reported their biggest single-day spike in new cases of the novel coronavirus infection. In Tripura, the number of COVID-19 cases rose to 423, with 102 people testing positive on a single day. In New Delhi, 20 police personnel posted at the Moti Nagar police station in West Delhi tested positive for COVID-19 on Monday. The first case at the police station was reported around 10 days ago, following which other staff were advised to remain in home quarantine. The SHO of the police station, his reader, an inspector and head constables who work with him, and personnel from the picket team are among those who have tested positive. The police station has not been sealed yet, but the entire premises was disinfected. According to an Indian Express report, an ICMR scientist who arrived from Mumbai to Delhi roughly 2 weeks ago has tested positive for COVID-19. The New Delhi ICMR building is now being sanitized and fumigated. The newspaper's sources have learned that the scientist who tested positive had attended a meeting last week. The meeting had in attendance Niti Ayog's V.K. Paul, ICMR's Dr. Balram Bhargav and Dr. R.R. Ganga Khedkar. Delhi's chief minister in a press conference today said even as more and more people in Delhi are contracting the novel coronavirus, there is no need to worry about medical care for COVID-19. He added that his government has made sufficient arrangements for treatment in terms of beds, ICUs and ventilators. He also added that the hospitals will decide if the patient requires admission or if home isolation would suffice. Arvind Kejriwal, along with this, also announced the launch of a Delhi Corona app that would provide information on the availability of beds and ventilators in various government and private hospitals. According to Bihar government's decision, from today onwards, migrants returning to Bihar will not be registered or quarantined. According to an Indian Express report, those who returned to the state till Monday had been registered and quarantined in more than 5,000 centers. Over 13 lakh people are hosted in these centers, and on the 15th of June they will be closed. Speaking to the newspaper, the principal secretary at Bihar's Disaster Management Authority has said that they were closing the registration on Monday evening. He added that in any case, maximum people have already returned. Bihar's Deputy Chief Minister Sushil Kumar Modi has said that foreign experts have concluded that home quarantine is the best quarantine. Thermal screening at railway stations is also set to be discontinued, but there will be a medical desk at every station to facilitate treatment to those who are unwell. Opposition parties in Bihar has criticized Nitish Kumar government's decisions. AICC Secretary Chandan Yadav has said that all those who are coming back now would mingle with the population and would further threaten to spread the infection. Tejashwi Yadav has said that at a time like this, the NDA has been thinking of elections in Bihar. He said that the BJP is planning a digital rally on the 9th of June, and this shows the insensitivity of the state government. A 33-year-old resident doctor at the All India Institute of Medical Sciences was served a show-cause notice after he exposed the substandard protective gear given to healthcare workers at the hospital. The notice was sent to resident Srinivas Rajkumar and refers to a tweet that he posted on the 25th of May. The tweet claimed that the statistics related to N95 masks issued by the Health Ministry and the ICMR were a lie. In the notice issued to the doctor, the AIIMS registrar mentions that the doctor's claims were not supported by any evidence. By virtue of holding these important positions, his words have the ability to influence the public and healthcare workers around the country. AIMS also said that the doctor chose to voice his claim on a public platform and sought media visibility to malign institutions. Rajkumar Srinivas has been expelled from the RDA for voicing his concerns. The Indian government today approved Gilead Sciences' antiviral drug Remdesivir for emergency use in treating COVID-19 patients in the country. According to a PTI report, the approval process for Remdesivir was accelerated in view of the emergency situation and the unmet need for medicines in light of the coronavirus outbreak. The drug has been allowed for restricted emergency use for treatment of suspected or confirmed cases in adults and children hospitalized with severe symptoms. India's CDSO, or the Central Drug Standard Control Organization, has also decided against extending the use of the drug to 10 days. The Indian Express report has also highlighted that as part of the company's risk management plan, the CDSO has mandated a system for collecting, processing, and forwarding information on adverse drug reactions emerging from the use of drug in India. Results of additional clinical trials of the drug will have to be submitted to India's regulator at least within 9 months. Meanwhile, active surveillance of all patients treated with the drug in India would have to be submitted on a monthly basis. That's all for today. Thank you for tuning in. You were listening to daily coronavirus updates from the 2nd of June on The Wire. We will see you tomorrow. Until then, stay safe.